with Sonia, and we're going to ask her about her experience with the TLC chair. Sonia, what procedure did you have done?
I was diagnosed with breast cancer, so I had a lumpectomy and I had some lymph nodes moved from my right side and my right breast.
Okay. Why did you rent the chair?
I actually heard about the chair from a friend who had surgery, and my main reason for renting it is I do live alone. I had no use really with my right arm, and I needed a place to stay and sleep.
Okay. What do you mean that you had no use with your right arm?
Well, because of the surgery and having lymph nodes removed, I can't physically lift my arm past my waist, so I can't use it. So I needed something where I could sleep and be comfortable in, and would help me also because I have a tube in me that's just kind of hanging there, and it's just more comfortable actually being in this chair than anything else in my house.
Do you sleep in this chair?
Yes, actually. I had my surgery on Thursday, and today is Saturday, so I have slept in the chair since Thursday, and I honestly don't know what I would do without the chair.
Did you try to sleep in your bed?
I did, and it was very uncomfortable. Once I actually laid down, my incisions tend to pool. I couldn't really get comfortable, and then my other big problem was once I decided to get in my bed, I didn't really know how to get out of my bed again because I really don't have use of my right hand, my right arm. So it was very difficult to get out of the bed once I was in it.
How many days do you think you will sleep in the chair?
Well, that really depends. Because I do have a tube, I'm not quite sure. But I can tell other women with breast cancer, if you had to have full mastectomy or partial mastectomy, that's a little more extensive than what I had done. I would highly recommend this chair because you will not have use of one or both arms depending on what you have done. And this is just a flip of a switch, and it makes it so much easier and just helps in my recovery.
Any tips for other patients having this procedure done?
Well, I highly recommend that you do rent a chair from TLC and make sure it's there before you get home. I would highly recommend you don't have anyone pick you up in a sports car. That's very bumpy for the way home. Also recommend that you get lots of button-down or zipped-up clothing to wear, light cotton, so it can air out. Again, because it's very hard to put it. When you don't have use of your hand, you can't put anything over your head. Make sure you set up a little table so you can put your remote control and your drinking water and your medication. I recommend a neck pillow, only because I'm a little short. And I also put a pillow under my knees for added comfort, just takes the pressure off. And I just feel very snug and comfortable in the chair because I'm a fetal sleeper, and I know I can't do that in my bed. This protects me so I know I can get a good night's rest in the chair.
And then it looks like you've got your chair set up in front of the TV, so probably having your cell phone nearby and your TV controller nearby is helpful.
Absolutely. Everything is right, just left hand away.
You want to demonstrate how to use the chair?
Yeah, it's very simple. There's a button, and again, because my right hand is affected by my surgery, I just move the control over, and it's basically just really a push of a button. Makes things very simple. And again, because I live alone, it makes it easy for me if I have to go to the restroom. All I have to do is push the button, and it helps me get out of the chair with no problems whatsoever, no added pain, no discomfort to me whatsoever. It's great.
So let's see how that goes when it goes all the way up to the top. So if this were the middle of the night